welcome to the second episode of the Dysmenorrhea Project podcast. Ladies, check yourself. My name's Sangavi.
I'm Jacqueline. We're two medical students who are passionate about women's health and want to take you all with us on our journey to learn more about this underrated side of medicine. As we're stepping into the start of October, which is also Breast Cancer Awareness Month, we'll be covering some basic facts about the condition alongside giving insights into new developments within this field.
In this episode, we will cover what breast cancer is, revealing some of its statistics in the UK, talk about the risk factors and symptoms regarding the disease. We will also discuss potential investigations to be done to diagnose breast cancer, any available management options, and discuss what the outcomes are for patients.
So starting off with defining what breast cancer is, it's basically abnormal cell growth in the breasts that sort of divides and grow uncontrollably. Eventually, this can develop into a tumor. It mostly occurs in cells that line the milk ducts and also occurs in the lobules, which is where the milk is produced, and also connects to ducts which lead towards the nipple. Both types can be invasive or non-invasive. So just some stats towards breast cancer. It's considered most common cancer in the UK and also amongst women, especially over their 50s. So 1 in 7 women develop breast cancer at some stage in their lives, and just a comparison, 55,000 women get diagnosed in the UK each year compared to around 370 men. So what are the factors that increase women's risk of getting breast cancer?
Breast cancer risk actually increases starting from when a female first starts her menstrual period. Other factors that amplify the risks include gestational exposure to cigarette smoke, so basically when your mother is pregnant with you and smokes. There's also diet, psychological state, maternal weight gain, and BMI. Conversely, if menopause occurs at an older age, so around 45 to 55 is a normal age range, there's actually a 2.9% increase per year of delay. Other risk factors that are non-modifiable, so you can't change them, include age, where most cases occur in females over 50, and genetics. In fact, 1 in around 450 cases of breast cancer involve a faulty gene called the BRCA1 or BRCA2 gene, which are normally involved in DNA repair. And mutations in these genes are responsible for around 2.5% of breast cancer cases overall. But these individuals will also have a strong family history, so are often already noted by the NHS in advance. There's also ionizing radiation, diabetes, and ethnicity. So normally white women have a higher risk compared to other ethnicities.
So what are some other factors that we can change or reduce the risk of breast cancer?
Some other risk factors which you are more able to control are also often more well known. So this includes obesity, high BMI, and physical inactivity, which tends to interfere with hormone levels, increases inflammation, and also affects the immune system. Alcohol consumption also promotes cancer development, and this has quite a few strong links actually. So data from the Nurses' Health Study indicated that women who consumed around 3 to 6 glasses of wine per week, so that amounts to around 5 to 10 grams of alcohol, were 15% more likely to develop breast cancer than non-drinkers. A 2019 study in Australia also compared data of over 200,000 individuals and found that regular alcohol consumption is actually the leading modifiable cause of breast cancer burden for premenopausal women. And so for people who are trying to reduce alcohol intake, the NHS advises not to drink more than 14 units per week on a regular basis. And if you do, try to spread this across multiple days as well. Other modifiable risk factors include taking the contraceptive pill and hormone replacement therapy, although these have very small increased risks, but might be something to consider.
Interesting. So considering, for example, childbirth, would that also affect breast cancer risk as well?
So interestingly, it actually does. Women are having fewer children nowadays and often later in life, which also increases the breast cancer risk. So childbearing prior to 35 years of age appears to provide long-term protection against breast cancer, with the age of the first birth being particularly important. And another interesting factor is also breastfeeding. So for every 12 months of breastfeeding, there's a relative risk reduction for breast cancer of around 4%. And it's believed that certain proteins, such as STC1 and STC2, they're called, are increased during lactation and can suppress specific genes that can lead to tumor development.
I don't think a lot of women know about this, maybe just because of like the misconception that breast cancer is genetically related mostly, and there's less awareness maybe on tops of like the non-genetic risk factors. So in terms of like breastfeeding, I think currently the rates are actually decreasing, so less people are breastfeeding. And research finding are saying that because of issues like lactation and maybe mothers' concerns in terms of the infant nutrition and weight, because they might worry that their breast milk is not nutritious enough for their babies. And also, if they're taking medications, would it affect the infant in that way through breastfeeding? And thinking about other things, so for example like work policies, the mothers might not have enough like parental leave, enough time to breastfeed in the first place, or they don't have like supportive environments to help them do so. And lastly, it might be like lack of family support is not under the cultural norms to breastfeed, and that's why it pressurizes them to not take up the habit like that. So the statistics for breast cancer can seem rather intimidating, but it's very important to remember that technology and scientific research has improved the diagnosis and management of breast cancer significantly. So it's no longer a death bell as it once was, and lots of people live for many years after a diagnosis. So depending on the stage of cancer when it's diagnosed, including like sort of the size and the spread of the cancer, according to the 2019 Office for National Statistics, found in England, at the point of diagnosis, 75% of individuals are likely to survive 10 years or more.
So, breast cancer outcomes depend greatly on the size and spread of cancer, as you mentioned, and so early diagnosis can make a huge difference, which is why regularly checking your breast is highly recommended. This is a very simple process that can be incorporated into your daily routine.
So there are some sort of symptoms for breast cancer, and obviously there's a lot of promotion towards like checking your breasts and for women to actually be aware of what symptoms might occur for that. So ideally, when you're checking, you should be standing, and using a mirror might be helpful because you can inspect the outline of both sides for symmetry and also note any skin changes. So just to talk about some normal changes in the breast, so usually it's one breast is usually smaller than the other, so it's not totally identical. It may feel different at various times of the month. So for example, it can be a bit lumpy just before a period. It may feel bigger and more tender during pregnancy. So for example, like younger women have more glands than fat, so it can feel more dense. And on the opposite side, during menopause, the glandular tissue replaces the fat, so it feels less dense. So moving on to the actual signs and symptoms that indicate breast cancer, if you see or see a change in size or shape, if there are skin changes, for example, like puckering, dimpling, rash, and redness, may indicate that. If your nipple is inverted, has unusual discharge or rash, which kind of looks like eczema, lump or swelling in your armpit, and breast pain may also indicate that. So if some women have the symptoms that were mentioned just now and are suspecting a breast tumor, what are some further investigations that can be offered under the NHS?
So, actually, because breast cancer is such a big issue in the UK, there's already a NHS breast cancer screening program. And so, as part of this program, all women who are between 50 and 70 years old will be invited by their GP for screening every 3 years. And if you're over 70, you may not be invited, but you can contact your GP or local screening unit to request screening. And also to note, if you are a trans man or a non binary person who was born female at birth and have not had a bilateral mastectomy, so that's the operation to remove your breast, or if you're a trans woman or non binary person who was born as male at birth and are taking feminizing hormones, you have to note that the invitations for screening are automatically sent depending on the sex you are registered with at your GP. So if you haven't received an invite but you think that you should have received one, then again, please contact your GP or gender identity clinic to book screening. And also, screening if you have a higher risk of breast cancer is available from a younger age. So if you have a strong family history or genetics, as mentioned earlier, the BRCA1, BRCA2 genes, then you will often be referred to a genetic specialist to assess your risk and then for earlier screening than usual. So just to cover what is screening briefly. So screening, you may have heard of before, involves 2 mammograms. So that's essentially an X-ray scan of each breast. It'll be taken from above and from the side for each breast respectively. And it's often quite a quick process, and the results should arrive within 2 to 3 weeks. And it's also important to note that even though there is a regular screening program in the UK, cancers can develop between mammograms, and mammograms may also miss some cancers. So that's why, again, just to emphasize the importance of checking your breast regularly, and if anything does seem to be different, then contact your GP immediately.
So there's been some research in terms of improving the screening system in the UK, and obviously lots of sort of scientific research behind that. So there's a new robotic breast examination device that's created by a team at the University of Bristol under the project Artemis, which is funded by the Cancer Research UK, and it gives women access to safe electronic clinical breast examinations, which can be located easily in places like pharmacies and health centres. So currently it's in the process of combining examination techniques from professionals with AI technology, and so it's not really public yet, but it's just part of like the new research that's going on. And this means that breast screening can potentially be conducted more frequently rather than a gap like every 3 years per se, because as mentioned, cancer can develop really quickly, and it can develop in the middle of the 3 years or just before the gap in between. So it might be too late till the next screening test for some people. So it's definitely a good sort of potential device to be used in the healthcare market.
Another interesting aspect of the screening program is that, as you're probably all aware, the NHS workforce is under a lot of strain right now. And so an interesting way to help reduce the pressure would be including more AI technology to how mammogram results are actually examined afterwards. So the standard method of screening in the UK involves mammogram results being read independently by 2 qualified radiology staff. And so this process maximizes accuracy and minimizes recall of people for false positives, but it is labor intensive. So another interesting aspect would be AI technologies such as mammography intelligent assessment, also known as MIA. And although this data is still lacking in this area, it does suggest that MIA is at least equivalent to a radiologist. So they could be used to safely and effectively shift from the current double reading human reader model to a single reading human reader and 1 AI reading model. So essentially replace the need for 2 radiology staff and use 1 radiology staff and 1 AI reader. So that could help reduce the burden, and then it would be an interesting way of screening, really. So now that we know how breast cancer may be diagnosed, what are the next steps after?
So there are a couple of things that can be done as management, and the first thing is more commonly known for as surgery, which is basically removing the tumor that's already present in the breast. It can be curative treatment depending on, for example, the stage of the cancer, and or a preventative measure just to prevent breast cancer from actually occurring in the first place. So the first one is called risk-reducing bilateral mastectomy, which is basically removing both breasts to treat or prevent breast cancer. Immediate breast reconstruction can be offered, and most women actually say that they're satisfied with the decision because there's a significant reduction in the worry of getting breast cancer again. But obviously there can be a less satisfaction with, for example, the cosmetic results, body image, and even like sexual feelings. So the other type of surgery is to remove both the ovaries and the fallopian tubes. So it's usually recommended to people who carry the BRCA1 and BRCA2 mutation, for example, by their doctors. And when it's recommended is by the age at which their ovaries or fallopian tube cancer risk increases above compared to the general population. So other than surgery, there are other things as well. So there's also radiotherapy, which uses high energy radiation beams to focus on the cancer cells, and it's sort of like a more targeted therapy, really. So yeah, you can sort of shine it on specific cells, a specific area to deal with the cancer. And there's also hormone therapy, which is if the cancer is caused by hormones, you can use hormone blockers, so it completely sort of addresses the cause of the cancer. And lastly, there's chemotherapy, which is also widely used for different types of cancers. So it kills the cancer cells and stops them from multiplying, but obviously there's also a risk of killing a lot of other healthy cells as well. So that causes a lot of like side effects that comes with chemotherapy. And it can be given before surgeries to shrink the tumor beforehand, or it can be given after the surgery to kill the cells that have been maybe residue around the surgical site or spread from the main tumor. So along with a lot of other diseases, preventative measures are always quite important things to take note of. So obviously we talked about the modifiable risk factors, and through changing your lifestyle, doing lifestyle modifications, for example, like reducing alcohol use, having more exercise, healthy diets, etc., can help reducing those risk factors that may cause breast cancer later on. And also, as we mentioned and emphasized a lot of times, please regularly check your breasts and attend screenings if you are invited to do so.
And that's a wrap for this episode by the Dysmenorrhea Project. We've learned lots about breast cancer, and hopefully this has increased your understanding and debunked any misconceptions relating to this disease. The sources used in this episode and links for further reading are listed in the description box below.
Please make sure to like and subscribe to our channel and follow our Instagram page for more future content regarding women's health topics. Looking forward to seeing you in our next episode.